Nice to see everybody. Good to know that that we stand between you guys and lunch, probably after a busy morning. But I'm hoping we can get some good discussion and questions and keep everybody engaged. So what we're going to do today is when Elizabeth reached out, she asked me to share a little bit about my story and why I started a business. Probably a little bit different than some of the other presentations that you guys have had. But for those of you around the table that might be interested in starting something, I'll give you my story, as well as talk about some of the current opportunities for new healthcare ventures. Obviously, COVID has changed the game quite a bit over the last 18 to 24 months, for good and also introduce some challenges, but lots of opportunity. Oh, can you still see the screen? Did it go away? Okay. So lots of opportunities there as a result of COVID and some of the interesting changes. And then we'll also talk about some of the key factors to consider when starting a business venture in the healthcare system. So just some ground rules. So I am a management consultant, so I just want to make sure everyone is aware that none of the views or anything that I'm presenting here are of my clients. There'll be some examples I'll try to give you, but this is these are my opinions and not those of the clients that I work with. I'm also not a data scientist, so you guys definitely have the expertise around the table. I am involved in many data projects and can provide some real life examples, but certainly not an expert. So I thought I would just make sure everyone's aware of that. And then also questions and comments are welcome and encouraged. So please do pop questions in the chat. I can try to incorporate some answers as we go. If not, there definitely will be time at the end. So a little bit about me. So I am president of Carvalho Group Consulting, proud graduate of the HIMF program. So it's been a few years now, but always like to participate in activities like this and help, with the interest of those that are part of the program. I'm actively involved in a number of different health tech strategy and implementation projects, mostly in Western Canada, but also with some national and international experience. Most of my experience has been in the implementation of large transformation projects, electronic medical records, EHRs, a variety of clinical information systems, but have over the last 5 or so years been more interested and involved in the health tech and digital health and life sciences startup space, helping to grow the innovation sector, primarily in Alberta, but now with the recent move over to BC, looking to do some similar stuff here, with an interest in virtual care, emerging technologies, and really that innovation to commercialization journey that we'll talk about a little bit today. So just to give you a better understanding of sort of where I started and how I got to where I am today. So through the health informatics program, did 3 co-ops, 2 of them with health authorities, 1 with a consulting firm. Through that, got to see the differences between the public and private sector, and then moved into my first role as a consultant, a small boutique consulting firm, which really helped me understand not only the industry, but also building that entrepreneurial spirit of a small company in this space. From there, moved over to work with MedAccess, who's now one of the TELUS EMR vendors, but got to travel around Western Canada, implementing and working with clinicians in the EMR space. This really was an exercise in not only some of the sales cycles, but also the implementation and understanding the importance of some of the core things we'll talk about in a bit. But great insight into implementing technologies in a clinical setting. After doing that for a few years, went over to work with TELUS Health, more focused on helping to build their consulting practice in the Edmonton and Alberta area. Did a lot of work with health authorities, but then also some smaller clients that were looking to implement some digital health technologies. And then after doing that for a few years, started thinking, what do I want to do with my career? Where do I want to go? And ended up starting my current company, Carvalho Group Consulting, in 2014. So they said based primarily in Edmonton, and then mostly recently in Victoria. So most of the work is focused in Western Canada. Typical management consulting type services with government, post-secondary, as well as industry. But I've spent a lot of time over the last few years working more in the digital health startup space, which is what we'll talk about today. For me, when looking at starting a business, really it came down to a few points here. Building upon that expertise or understanding of these large organizations, I did want to have more ability to focus on areas of interest that sort of aligned with my core values and core objectives. It did give me some increased autonomy and responsibility and ability to test and trial and implement new methods, new lines of business, and get more into the startup, angel investing, sales and distribution, commercialization activities, really using the experience from the healthcare system, but trying to help introduce clients into that space. With that, though, it definitely does bring, the need to focus on multiple streams of activities, customer acquisition and business development, project delivery, HR, finance, people management. You really are responsible for everything. We're working for a large organization. You can focus more on the delivery side. So definitely for the type of work that I like to do, that fits well, and certainly enjoy that. But these were some of the reasons why I wanted to start a business. I'll skip over this one just given the timing. And let's take a look at the current opportunities for new healthcare ventures. So this is just a slide here, and I give credit to Junior Achievement BC. I do a course for grade 5 students that are interested in starting businesses. And when we take a look at, why starting a healthcare venture, the 3 important business components, an idea, customers, and then can we actually create a profit? So when we take a look at the healthcare space, from an idea perspective, this is a great place to start and grow a business. Industry is familiar with research and innovation. It's not a foreign concept. People are usually looking for new and innovative ways of doing things. There's lots of opportunities to solve problems, make processes more efficient, save money, you name it. There really is, endless opportunity in the healthcare space for these things. On the customer side, most of the customers, and in this case, the providers, are typically well educated and interested in advancement. They want to be able to see more patients, provide better patient care. So they're always looking at ways of solving problems in a unique way, where they're an active and engaged customer base. There's also a never-ending customer base. Healthcare is not going anywhere, and if COVID taught us anything, we need to be more nimble and be able to react. So whether your customer is a provider, a patient, a payer, huge customer base. So the opportunities are also endless there. And then from a profit side, obviously you can't have a business without profit. It's a publicly funded system. Year over year, the budget is increasing. And the system does require us to start thinking about things in a different way. The investment in the digital health space over the last 5 years is insane compared to many industries. So all of these things are working, in your favor if you are interested in starting a venture. However, if you're in this space, sometimes it probably feels like this is more of the reality. It is a difficult market to play in. The long sales cycles. Whether you're going direct to a patient or provider, or through an RFP process, can take 18 months or more to get out and complete your sales cycle. There's strict and complicated guidelines and regulatory requirements for good reason, but that is a factor that plays into the overall development of a product or service. Evidence is required. Again, there's definitely reasons why, but things like clinical trials or health technology assessments typically take longer for healthcare related products than for other industries. And that's to make sure that appropriate decisions are made. Customers are typically risk averse, again, rightfully so. Patient care is at the forefront of making some of these decisions, but it can be difficult to find a first customer because the risk level is typically low in the traditional setting. And industry is dominated by some of these large organizations. So as a small player trying to get into the system, it can be difficult to do that. You've probably talked a lot about this, data siloed, making integration difficult or impossible. And some of the policies that are governing the implementation or the work on this are either outdated or non-existent. And the list goes on, but just wanted to highlight a few that typically come up when we're through the companies that we're working with. However, though, through COVID, I think our industry has been accelerated significantly. I'd say Canada was probably slightly behind some other jurisdictions. I think through COVID, we've been able to catch up. Some might argue that we're still behind in terms of the way that we're thinking or operating, but we've certainly come a long way over the last 24 months. That should make it a more friendly environment for digital health startups to work within. Definitely through COVID, it's identified gaps in our current commercialization pathways for health companies, leading to many funding programs and opportunities to help with that. And it's forced the system to make some policy changes to start adapting these technologies quickly. So even if we saw, virtual care is a good example of fee codes and platforms that became available, even if temporary, we know that it's now possible to make some of these health related changes that will impact the ability for digital health companies to thrive. And then initial innovation was accelerated and systems are now more accepting base. Many differences between provinces and jurisdictions. So when you're thinking about, growing a company, this also helps to identify where your entry point may be, just given the readiness of various provinces or areas. And it's also highlighted the importance of, data accessibility, sharing standards, integration, and interoperability, because ultimately, as a digital health product, most clients will want some aspects of those factors to be delivered. And I think the key thing coming out of this is that, all of the potential barriers through COVID, it has shown that, when there is a will to do something, in a timely manner that has impact for patients in the system, it can be done, and the appropriate governance and funding and prioritization can happen. So overall, there has been a significant amount of opportunity that's grown. What we're seeing is some of the key areas that for those that are interested, and especially from a data science perspective, many of the opportunities out there have a few flavors that I'll point out here. So typically, it's consolidation, access to, or use of data across the sector, whether that's public health, similar to the presentation that we had previously, or decision making. I think currently we probably don't do a great job in our system utilizing the data that we have to make decisions, whether that's procurement or clinical care or whatever it might be. But there are huge opportunities to start to leverage the data in a more usable and meaningful way. Leading into that, lots of opportunities for predictive modeling or prevention or precision medicine. Lots of tools are starting to be established, or interest in those types of preventative and precision medicine companies, or digital therapeutics, diagnostics, sort of you name it, on ways of utilizing data to help solve problems. And then from a funding opportunities, there's lots of these provincial or federal agencies that are interested in helping us support anything that's related to AI or ML. There's lots of opportunities there, as well as anything in the mental health and primary care space. So huge opportunity to look for funding as a starting point. And as I mentioned earlier, there is significant investment globally in the digital health products or service area. So from a point of view of getting some dollars to help start or to commercialize your product, there are many opportunities in this space currently. So when thinking about all the opportunities that are there, I think also with COVID, it's shown that no matter where you are or what you're doing, there are some key factors that always seem to come up when starting a healthcare or healthcare sector business, specifically digital health. So what I want to do now is just go through a few of these. I'll also try to give some real world examples of how, with some of the previous work we've done with some clients, primarily in Alberta, how we've identified some of these problem areas and then tried to build out these platform type initiatives to help make it easier for companies to operate in this space. So before we get there though, I think the critical success factors, whether you're developing a product or service or doing an implementation, it really comes down to the people, the process, and I call it the product. I think Catherine mentioned that, which is great to see that they're thinking about it in that way. You'll probably see many of the speakers over the couple of days that you're with them talk about it in this way, but it's a good way to organize thoughts and make sure that you've worked through the process in a meaningful way. So first is the people side. Whether it's, if we're talking about a product, your customer or your users, or your clients, but really understanding, what are their pain points? What is the problem that you're trying to solve, and what is the value that you're able to bring to them? Through that, making considerations on, do you have the right business model to be able to ensure that they have capacity within their organization to implement the technology? What is the procurement cycle like? So anything related to that people side. How are you providing value to the individuals that will use or purchase your product? On the process side, the key thing here is how is your product going to actually integrate into the current workflow, and what requirements are documented and understood, so that when you're going out, you actually can demonstrate that you are solving a business problem. And then on the product, it really does come last. There's lots of different technologies out there, and many of the startups that I work with, they lead with product, but they haven't thought about the process or the people, and it can be very difficult to get their first demonstration client or even make any inroads. But really the product needs to be thoughtfully come out of answering questions around the people in the process, and making sure that the product or the service or the technology that you're implementing really does meet those needs. And we'll talk specifically about integration and interoperability as one of those outcomes that will help with that. So regardless of company that I've worked with, or stage of development or desire to commercialize, the three most common barriers that these groups need to overcome are outlined here. So access to systems, access to data, and then access to customers. We will talk primarily about access to systems and access to data, just probably because of the interest that many of you have around the table. And then, as I said, I'll give you some examples of how we've worked with some clients to set up some platforms to overcome those. So the first, access to systems, there's many siloed systems that contain either partial information or duplicate information, but whether it's an EMR, clinical information system, a DI repository, a registry, there's all these different siloed systems that are out there that can make it difficult for a digital health company to even understand where they want to start. Again, data standards are inconsistent or non-existent. I can tell you, I've implemented, 50 plus EMRs across Western Canada, and although they're using the same system, the way that individuals are entering information may be different. So just because you have a field that has the same, heading, it doesn't mean that everybody's using it the same way. So because of that lack of standard or inconsistencies, it can even be very difficult for some of these integration activities to occur. When we talk about integration or interoperability, typically for a startup, these are very costly, they're time consuming, and they can be very difficult to navigate. On the acute care side, so if we're thinking, EHR or provincial systems, large vendors that may be implemented within these acute care organizations, they might have APIs that are published or accessible, but typically they're inexpensive, or the cost structure does not favor the startup. So it ends up being very difficult to actually achieve the integration that one might be looking for. On the primary care side, and speaking more from the Canadian marketplace, EMR vendors, other than one or two, it's a very closed system, or they may want a significant revenue share to be able to actually allow for integration. So there are certainly limitations on getting integration as an early stage company. The challenge there is that clinicians will request, or customers will request, that any digital health product has some form of integration. I can say there's been lots of conversations that I've been part of where you try to introduce your product or service, and that is usually the first question that is asked is, do you integrate? So there are certainly ways of showing, I call it manual integration. Can you build a process and the workflow to allow someone to use it as a first customer before they actually move on to that full integration path? But it is something that is important to consider early on, the privacy and security requirements to be able to support this type of work. So what we've done in Alberta is build out what we're calling a digital integration readiness platform. And through that, so it's a partnership between a group called Health Cities. They're an economic development agency that is intended to help break down barriers for innovators, researchers, those in the startup space, and integrate them into the healthcare system, as well as a partner, Bright Squid, who has a secure messaging platform that's been approved through the TELUS EMR suite, as well as work with the Alberta Health on the My Health portal. So we try to build out a platform where we can start to train companies earlier on to think about some of these privacy and security and regulatory requirements, so that they don't spend all their money on developing a product that can't actually get integrated into the healthcare system. We've put on a few different cohorts of this, and really the focus was, companies were coming in at various business validation stages, or technical validation, or clinical validation. All of them may be at various stages of those pieces, but we really tried to focus on how can we help to build out that technical or privacy security component to make sure that we're producing better, more qualified companies that have already taken into consideration the key factors that will ultimately get them to successful integration. Just given time, I'll quickly skip through some of these here, and just highlight this slide here. There's lots of different ways, and if you are interested, certainly take a look at this slide to give you a better sense of the key areas to focus on in your development cycle, for product market fit, business readiness, regulatory, and product development. This will give you a quick indication of some of the key questions that you should be looking at. I'm probably over time, so maybe just really quickly on access to systems. Similar challenges that we talked about in access to data. We need to be better from a system perspective in making better decisions, utilizing the health data that we have. In Alberta specifically, and I'm sure it's similar in BC, it's difficult to obtain clinical data without academic affiliation. And if you're an SME or even an MNE, you need access to that data to help develop your algorithms and your process and some of those pieces. So it makes research and development and innovation activities very difficult in many cases. Large data sets do exist, but are often difficult to access, mine, clean, or consolidate. And current privacy and data legislation can be vague and outdated, again, making it difficult to access. So working with this, we know that we need to also build the workforce that's going to be able to consume and utilize the data, but without actually having access to the data can be difficult to get there. So really quickly, we've started an initiative where we're trying to show that developing synthetic health data can actually be utilized by industry for its own purposes with direct access, to make it more accessible and easier to use for individuals that are interested in this space. Synthetic health databases they use statistical methods to maintain the properties of the original data, but essentially it's fake data. So it should be more secure, should be safer, but still have the properties that are required to assist in further development of protocols or algorithms or digital health products. We're in the process right now of working with industry and are very close to being able to actually share a validated synthetic data set. And we're hoping that this can be one of the first use cases to be applied nationally, if all goes well, to start to share this data in a more accessible manner. This should also help with commercialization activities for digital health companies, but they can start to help refine and validate their product. So we'll skip through this one here. And yeah, just to recap, I think, if you're an early stage company, it really is making sure that from a people, process, and technology perspective, you do start to think about, how you overcome the barriers, the access systems, access to data, and access to customers. So I'm definitely over, so my apologies, and happy to answer questions after.
I'm Jerome Etwaroo. I'm the director here at the Coast Capital Innovation Center, and it's the on-campus startup incubator. So I will be talking mainly about support around and around entrepreneurship. And if you're interested in, you're looking for starting a business, a lot of you are in data science, and I will talk a little bit about that. But I will go through the slide, and at the end, it will be great to have your questions and see and to hear from what you're thinking. Okay, so as I said, we are the startup incubator here on campus at the Coast Capital Innovation Center. We have a second incubator in downtown Victoria. It's called UVic at Quench, and very soon we'll be launching a Bioinnovation Hub, which actually fits closely to what all of you on this call are doing. And so that will be announced very soon, and it will be a great support mechanism for those of you who are thinking of starting a business, or whether it's consulting or social innovation or data science business, whatever it is. It will be a great location to be able to support sector specific within the region. Okay, so our service is it's free for all. It's open to the entire UVic community. That's faculty, staff, students, alumni. So it's a free service for those who are doing research programs, and for faculty member. UVic has a IP policy, and that's the only consideration, that the IP policy needs to be followed. And so, but the incubator service on campus is a free service. Same at UVic at Quench. The UVic at Quench, which is downtown Victoria, is open to the entire community and students. So if there is anyone who is on this call from the community and you're looking to start a business within the region here, UVic at Quench it's there to be able to support you. Here are some of the recent some of the startups that we've supported recently. So I will get back to this a little bit more, but this is a few that I have put out here, and specifically because of that bioinnovation data-driven side of stuff, and so you can see some of these companies. And from this slide, I will send this slide later. You can definitely go through some of these companies. Pani Energy is a very interesting one, and the reason I included them, they're working on water systems and improving efficiency in desalination plants and those kind of plants. They have been very played a very critical role in the pandemic, during the pandemic, with doing some research around wastewater monitoring and things like that. So it's a very interesting startup company and a very growing one here in Victoria. So our aim here at the university, from a startup incubator perspective, is to ease that entrepreneurial pain, and that's the main mission, is to be able to support you in what you're doing in your startup activities, and how can we reduce that those challenges that startup usually face at the beginning of their journey. We support people from all stages. So you can be exploring, you have a concept, or you have a wild idea and you want to explore it. The ideation stage, where it's a little bit more developed into an idea, and an incubation stage where you're looking at product market fit, minimal viable product, your business model, looking at mapping your path for raising capital and securing your first customers and things like that. And so Chris talked a little bit about this, and I will go into it a little bit details. Is that one of the things from our experience that we have seen at supporting startups, and it doesn't matter the type of startup, is that there are three critical components that we see time and time again that are key for success. First is the ability to have a good idea. And a good idea is to be able to identify opportunities. What are the opportunities, and being able to do some customer discovery, that we would normally call it, getting out there, talking to potential customers, understand whether there is a pain point, the idea is going to be overcoming. The second part is to be able to have a team to execute. And this is a very, very critical one, because you can have the best idea, and without a team to execute and being able to bring it to market, it can be a challenge. And so a team, we have seen, it's a very, very important piece. The third, the ability to plan and overcome unforeseen. There are definitely some things that are unfavorable context that can present challenges, and sometimes as an entrepreneur, being able to have the ability to navigate through those circumstances are very important in the success of a startup. Our approach is that we have a two-stage approach. We have curated support for each entrepreneur. It's not the most efficient process, but for each entrepreneur and each one who have an idea, each person, we work with them to figure out where they're at and how to provide support around that individual entrepreneur. We look at the identification opportunity, customer discovery, developing solution and business model, test product, and launch. And that's we have an entire infrastructure to be able to provide support in that entire spectrum that we are looking at of support. So our service and support is three different categories. We can categorize it. We have the startup support. We have the experiential and dynamic learning. I know Chris talked about doing co-op, and I'll talk about that briefly. And then the third part is community building. So here are some of our support. So we have a prototype and business development fund. So for each entrepreneur, if any one of you are considering starting your own business and you're looking for a prototype fund, we have a small pot of money that we provide to entrepreneur to be able to test their ideas and see whether there is traction. Secondly, which is the biggest part of it, is mentorship. So we have mentorship subject matter experts and executive in residence that work one-on-one with entrepreneurs to help them through that entrepreneurial journey. And I think from my experience, the mentorship is one of the most critical pieces. We have a free operational space here on campus, and as I mentioned, we have Ubiquit Quench and some new hubs that will be going up in the next few months. We have our networks and partner. We work with a lot of other accelerator programs and incubators and funders. We run our pitch business plan competitions, and then we have access to partnership credits like AWS credits and Webflow and MathWorks and things like that. So some free third-party service that are provided through our support. So the second aspect is the experiential and dynamic learning. So we run these 14 weeks program that are for early stage entrepreneurs and anyone who are exploring, and it's a 14-week course. Basically, it's free, and we bring in subject matter expertise every week, and to be able to talk about different aspects of a startup. So for those of you on this call, you're thinking about things like patenting, IP, you're thinking about finance and regulatory issues, and we bring people in to speak to each one of those subjects and being able to provide some support around it. The second is entrepreneurial co-op. We support co-op students who are interested in taking a semester off of their regular co-op and work on their own startup ideas. And so through the university, we have some wage subsidy available for students who are thinking of doing that. So if you have a good idea and you're a co-op student and you want to take advantage of this program, I would encourage you to speak with your co-op advisor. The third is the MyTax E-Accelerate program. For graduate students, this is an excellent program where a student can start their own business and being able to utilize the MyTax program. And we see a lot of this with grad students, and both the entrepreneurial and the co-op and the MyTax E-Accelerate have been a very popular program with our entrepreneurs, and we have found so far it's been a very successful program. These are successful programs because we have seen a lot of positive impact where companies have gone out and raised a lot of capital, increased their market cap, and hire a lot of people, and creating a lot of impact within the community. And the third is that we run this program called W Venture in collaboration with Accelerate Okanagan Biotech, with funding from the Canada Digital Supercluster. It's a program made specifically for women founders who are looking to grow their business. These are just some statistics of some of the stuff that we have done. And I'm going to try to get to this slide here. And why I want to speak about this is because the pandemic, as Chris was saying earlier, has changed a lot of way of business and the way people look at problems. And one of the things we have seen at working within the entrepreneurial space, there has been an increase during the pandemic of entrepreneurial activities. And one of it, as I was thinking about that over the last couple of years, this slide from ideas to enterprise actually sum it all up, is that you had the pandemic presents a new opportunity, and it's presents a lot of opportunity for where people are identifying new pain points, and it's a timely one. A lot of these challenges are solvable. They are very important because they're important in helping overcoming some of the challenges. There has been an entire new market open up, and it was a favorable context. There were a lot of funding available to be able to support early stage activities and hiring students and things like that. And so we see a lot of startup that functioning in this space, and because the pandemic has created a very conducive environment to be able to identify new opportunities. And the second aspect, you can definitely identify opportunities, but you need to have the interest, passion, and commitment. And the third part of the capabilities and skills, and that's where again, team comes into play. And one of the things that from this you can see that the sweet spot is actually where those three things intersect. And we have seen it from the work we have been doing, is that successful startups, is that the sweet spot is in that area, is that when you have an attractive opportunity, interest, passion, and commitment, and the capabilities all come together in a nice fashion. And I know I've gone over time. I just want to say these are some of our partners and sponsors, and with that, I will go to questions. I just reduced my 25 minutes presentation into 15. So.